inviting me to come here for this very important occasion. Nobody from any perspective can pretend that chemotherapy is plain sailing. Sometimes chemotherapy drugs are given by mouth, but for many cancers, chemotherapy by injection is the standard treatment. And this may need to continue for many months. If this can be given safely at our local hospital to save arduous 100-mile round trips, then so much the better. During some 30 years working at North Devon Hospital, I've seen many changes which have aimed to improve the safety and acceptability of this treatment for patients. When I first started at the hospital, patients were given their treatment in smoke-filled waiting rooms and outpatient departments. The medication was being made up by young junior doctors in ward-side rooms. Chemotherapy drugs can be toxic to patients, but can also be hazardous to those who prepare them and administer them. So a first step was to ask the pharmacist to prepare the drugs on the ward in a special safety cabinet that had been bought for us by a local charity. Then later on, the pharmacy, again with local charity support, was able to build a state-of-the-art drug preparation suite within their department. So much for the technology, then what about the patients? Finding ways to ease the lot for patients was not going to be quite so straightforward. Strangely, an opportunity arose when national funding was offered, instead to improve the lot of overworked young doctors. This was our chance to appoint a specialist chemotherapy nurse, Kathy Peters. And as the number of people needing treatment increased, we gradually built up a team of well-trained specialist nurses. As you can imagine, this transformed patient care. The nurses became highly skilled in intravenous access techniques. They had time to listen to patients' concerns, and they were able to alert doctors about their problems. By this time, national trials comparing treatments were becoming more widespread and protocols increasingly complicated. It was important for the hospital to contribute to this research, which at the same time gave patients the opportunity to benefit from some of the latest treatments available. The appointment of oncologists and the development of a team of specialist research nurses successfully improved the quality and range of care that we were able to give. As you can appreciate, teamwork is so important in this area, and teams work better with good communications and proper facilities. It's therefore a great pleasure for me to see the realisation of this long-held dream that we should have our purpose-built chemotherapy unit, bringing together professionals involved and improving the comfort and privacy for patients. I feel very confident that the skilled teams who work here will use this to the best advantage of the people of North Devon who are contributing so much to its achievement. Thank you very much. Now I'm going to ask Sharon Bates to talk to you about what you really want to know.